Hey, welcome to our explainer. Today, we're diving into one of the most incredible journeys in nature, the roughly 40-week process of pregnancy. I mean, really think about that. How does that happen? It's a question that is both incredibly scientific and, for many, deeply personal. So over the next few minutes, we're going to map out this amazing transformation from the very beginning all the way to birth. Let's get right into it. And to get a sense of just how common this journey is, look at this number. Back in 2012 alone, there were an estimated 213 million pregnancies worldwide. It is a fundamental, universal part of the human story. So, where do we start? Well, we have to begin with the fundamentals, what pregnancy is, and just as importantly, how we measure its timeline. And you might be surprised to learn that tracking it can be kind of complex. At its very core, pregnancy is simply the period where one or more offspring develops or gestates inside a uterus. Simple enough, right? But that one event kicks off this massive cascade of physiological changes throughout the body. Okay, so here's where things can get a little tricky. Timing it all. You see, the most common method doctors use is called gestational age. And get this, it actually starts from the first day of the last menstrual period. That's about 2 weeks before fertilization even happens. It's kind of like starting the countdown for a rocket launch before you've even lit the fuse. Now, there's also fertilization age, which starts at the actual moment of conception. But for this explainer, just so we're all on the same page, we're going to stick with the medical standard, gestational age. All right, now that we have our timeline straight, let's dive into the first of 3 major stages, the first trimester. This is the initial 12 to 14-week period, and it is absolutely packed with the most dramatic and foundational development. It's also, unfortunately, the time of the highest risk. So how does it all kick off? Well, it starts with a single sperm fertilizing an egg, which usually happens in the fallopian tube. This creates what's called a zygote. And right away, that one cell starts dividing and dividing, becoming this tiny ball of cells as it makes its journey towards the uterus. Then, about a week later, this little cluster, now called a blastocyst, finds a spot and nestles into the uterine wall. And that's it. That's the moment we can say a pregnancy is truly established. And how does the body signal that this incredible change has happened? Well, the earliest clues are often things like a missed period, really tender breasts, and of course, that infamous nausea that we call morning sickness, even though, it can happen any time of day. These are basically the body's first reactions to this huge surge of hormones that are now at work. Now check this out. By just 4 weeks gestational age, that's only about 2 weeks after a missed period, something truly mind-blowing is happening. The basic outlines of the organs, the body, and the entire nervous system are already being sketched out. It's like the architectural blueprint for a human being, taking shape at a literally microscopic level. But, as I mentioned, this early stage is incredibly delicate. About 10 to 15% of pregnancies that are actually recognized end in miscarriage during this first trimester. In the vast majority of cases, it's because of chromosomal abnormalities, basically a fundamental issue in the developmental plan that means the embryo just can't survive. It's a truly heartbreaking, but unfortunately common, part of the journey for many. Okay, so making it through that critical first trimester brings us to the next big phase of the journey. In this stage, the focus really shifts to rapid growth. We're going to see how both the developing offspring and the pregnant person's body go through some really profound changes. First up, a quick but important change in vocabulary. For about the first 10 weeks, we call the developing offspring an embryo. This is the period of organogenesis, which is just a fancy word for when all the major organs are being formed. It's like building the foundation in the frame of a house. Then after that point, it's called a fetus, and the job shifts to growth and maturation. Adding the walls, the wiring, and the plumbing to that house. And right around week 10, a huge milestone is reached. The fetal stage has officially begun. The risk of miscarriage drops way, way down, and a heartbeat can now be clearly seen on an ultrasound. The fetus is only about 1.2 inches long at this point, but it's already making tiny little involuntary movements. Jump ahead to 20 weeks. We're at the halfway mark, and another incredible milestone often arrives. The pregnant person can start to feel the fetus moving for the very first time. This feeling, which is called quickening, is often a really powerful and emotional moment of connection. By now, the fetus is developing its senses, it can swallow, and can even hear sounds from the outside world. All right, let's fast forward all the way to 40 weeks. The journey inside the womb is pretty much complete. The fetus is now fully developed. Its organs are mature, and things like the lungs are even practicing breathing motions. It's usually settled in a head-down position, getting ready to make its grand entrance into the world. And while all of this has been going on, the pregnant person's body has been running its own incredible marathon. We're talking a dramatic increase in blood volume, the heart working way harder to supply the placenta with nutrients, and the uterus itself expanding from about the size of a lemon to taking up a huge part of the abdomen. It is a total body transformation. So with all these incredible complexities, how do you manage a pregnancy to get the best possible outcome? Well, let's take a look at a few of the key pillars of what's known as prenatal care. The single most important factor, hands down, is prenatal care. Those regular checkups with a doctor or midwife are absolutely crucial for preventing, spotting, and treating any potential complications, from high blood pressure to gestational diabetes. It's truly vital for a healthy pregnancy. And what about physical activity? Well, for most uncomplicated pregnancies, the general recommendation is at least 150 minutes of moderate intensity exercise every week. This doesn't just help with fitness and managing weight gain. Some studies show it may even reduce the need for a C-section. Of course, nutrition is a huge priority. Certain nutrients, like folic acid, are vital, especially before and in early pregnancy, to prevent some really serious birth defects. And just as important is what to avoid. Recreational drugs, and that includes tobacco and alcohol, can cause severe and permanent harm to the developing fetus. And here we are. We've reached the final stage of the journey, the arrival. The destination is birth, but the timing of that arrival is key. So let's look at what term actually means and what signals the start of childbirth. So it turns out that not all term pregnancies are considered equal. This table shows the more modern definitions. While anything after 37 weeks is technically term, a lot of research shows that babies born between 39 and 41 weeks, what's now called full term, actually have the best health outcomes. Their lungs, brains, and livers are just that much more developed. And finally, we have childbirth itself. Medically, it's known as labor and delivery. And it's the process that officially begins with those regular, powerful uterine contractions that cause the cervix to change, which ultimately leads to the birth of the baby and the end of this incredible 40-week journey. So from just 2 cells to a fully formed human in about 40 weeks, it's an extraordinary process we've just mapped out. But there's always more to learn. And as our medical knowledge and technology just keep advancing, it leaves us with a really fascinating question. How will our understanding of this most fundamental human journey continue to evolve in the years to come?